It gives me honor and pleasure to be able to welcome you to this event. We are receiving this donation of 8 vehicles to be able to enhance our preparedness and response. This support is coming from WHO, and we have had a long-standing relationship with WHO dating to more than 60 years. And we are doing a lot more apart from this donation that we are receiving today. We are working on the logistics hub. We are also building a center of excellence for assistive technology. It is important for us to be able to receive this kind of support because Africa as a continent suffers daily 100+ public health emergencies. And therefore, you need to be able to have a strong and robust, resilient system that can quickly be able to respond and bring the emergencies, including outbreaks, to a quick close.
I am delighted to join you again at this very important event to hand over 8 vehicles and to officially launch the implementation of the Emergency Preparedness and Response Flagship Initiative in Kenya. I am pleased to say that Kenya is among the 17 pilot countries in Africa where this initiative is being implemented. The flagship initiative was created with the aim of establishing a sustainable, efficient, and resilient system that guarantees early detection of public health concerns and rapid deployment of emergency response. The initiative is part of WHO's new regional strategy that seeks to transform health security. This strategy was developed during the 72nd session of the World Health Organization Regional Committee for Africa held in Lomé, Togo in 2022. By adopting this strategy, WHO's member states agreed to reach 12 targets by 2030. These targets will strengthen their capacity to prevent, prepare for, detect, and respond to health emergencies. It requires that 80% of member states have sustainable health security financing, as well as 90% of them being able to mobilize an effective response to public health emergencies within 24 hours of detection. It also includes the ability of all countries to have 80% of health districts with functional service delivery and quality improvement programs. The flagship initiative adopts a 3-components operational approach. 1, transforming African surveillance systems, also known as TAS. 2, promoting the resilience of health systems for emergencies, or PROS. And 3, strengthening the utilization of response groups for emergencies, SURGE. So, TAS, PROS, and SURGE. The TAS component of the flagship will help strengthen the implementation of the integrated disease surveillance strategy and response by improving the interoperability between different surveillance structures and data sources, including the use of electronic systems to detect and respond to public health emergencies in a more efficient manner. PROS will strengthen Kenya's capacity to anticipate risk, plan for contingencies, and prepare to mobilize human and material resources to swiftly and effectively prevent and mitigate the risk of emergencies. Finally, the SURGE project will establish a national-level cadre of locally trained multidisciplinary personnel, put in place systems to improve readiness and response coordination, and strengthen existing infrastructure for rapid and effective emergency response at the national and also sub-national levels. As we hand over these 8 vehicles to boost timely response to public health emergencies in Kenya, we reaffirm our commitment to sustain the strong partnership with the government of Kenya.
Previously, the Ministry of Health was viewed by partners and Kenyans at large to be some sort of a dark room that people did not know what normally happens at Afya House. They would only hear about Afya House when there's a scandal or when there's something bad. But I, as the Cabinet Secretary, am determined to change the image of this ministry. And that is why when the vehicles arrived, I said, we are not a yard for vehicles. Neither are we a bazaar for selling vehicles. Therefore, the same day we receive the vehicles, we will call the recipients to go away with the vehicles. That is just a demonstration of how we want to be transparent as a ministry. And I really want to thank World Health Organization. Today, we are here because WHO has partnered with the Ministry of Health to support a number of countries in emergency preparedness and response through a flagship program called Emergency Response. This program is aimed at strengthening our capacity and other countries to prepare for and respond to emergencies, and particularly public health emergencies. This program, Kenya will be able to detect, assess, and respond to outbreaks and emergencies in a timely and effective manner. Accordingly, a scoping mission was commissioned by WHO among member countries in November 2022 to conduct advocacy meetings with stakeholders within the countries, to conduct situational analysis, and develop a government-led roadmap for the full implementation of the flagship initiative. The roadmap draws its activities on priorities to be implemented over 2 years, and WHO would provide seed funding to commence the government-led multi-sectoral implementation using One Health approach. Towards this end, the following have been achieved. There's a costed implementation plan, which has been drawn at a cost of about $50 million US. There's an MOU that has been drafted and is currently under review for signing. There was 118 surge staff drawn from national and county governments have been trained on EPR, with the latest group having graduated in Mombasa yesterday. This is a demonstration of a good collaboration between ourselves, Ministry of Health, WHO, and the country at large. Ladies and gentlemen, I am aware that MOU provides a guide for collaboration under this program. Among the agreement will be measures for efficient use of vehicles and fuel, including maintenance and fleet management, provision for the emergency response program, and coordination team. So today, we receive 8 vehicles, 5 Land Cruiser hardtops, 1 ambulance, and 2 double cabin vehicles.